Good afternoon, everybody. Thanks for being here. So, unfortunately, we lost one neighbor over the last 24 hours related to COVID-19. Uh, Female in her 80s. So, certainly want to think about her and her family and everybody we've lost over the last 13 months. It's been quite a run here for the community. 7-day rolling average 0.8, 14-day rolling average 0.8, 30-day rolling average almost 0.8. So that we're in a good spot with positive rates, and we're seeing same trends. 74% of the new cases under 40. If we want to look at under 60, 92% of the cases under 60. New cases today 68. And we have now had over 33,000 positive confirmed COVID-19 cases in the community. Hospitals down to 30. So our hospitals, hospitalizations are really going in the right direction. This makes sense if you think about it from the standpoint that we knew hospitalizations were driven from congregate care facilities related to senior housing. If you were a senior overall, you had a harder time with this virus. And then if you have comorbidities, certain comorbidities, you certainly have a hard time with this virus. The younger demographics, for the most part, have fared better when they get COVID. So really, if you around the holiday season, we were really in a bad spot with our hospitals, to the point where they were getting pretty close to being at capacity. So to be really just 60 days away from that, 90 days, to be at 30 of our folks, it's quite an accomplishment. And I want to thank all of our partners at the hospitals who've been working so hard, and their staff. We have 8 of our residents in the ICU out of that 30. So hopefully keep them in your thoughts and prayers so they can get better and get well and get home. On the vaccine, so we've now vaccinated going into today over 155,000 of our residents. When you look at it's about 43% of adults. We're trying to do 2 things. One, vaccinate as fast as we can. And it's getting tough with the eligibility management out of Albany. So to gauge really what the really participation levels will be, we're going to start consistently having pre-registration. That gives us an idea about demand in different age demographics. Remember, if you've had a comorbidity, it doesn't matter really what age bracket you're in, you've been able to get a vaccine now. So right now, state eligibility criteria 50 and above. We set up last week, I believe, or was it earlier this week? I think it was earlier this week. 40 and above, you can pre-register. We're going to expand that pre-registration today to 30 to 50, so 30 to 50. I know on our list, I think we had about 3,000 people on it right now. This does a couple things for us. One, in the event that we have extra appointments, it makes 0 sense for us to pay lots of vaccinators to stand at the on-center all day, and then that day we only have 300 or 400 appointments that are taken up due to eligibility constraints. So it's a waste of money. And when we have vaccine in the freezer, we're just not going to play that game. So in the event that we have appointments that day, we'll reach out to these groups to get them registered to get a shot. Secondly, we will never waste a shot. And we will reach out to those groups in the event that we have no shows during a day and we have vaccine that has been thawed that needs to be used. So secondly, it will give us a good idea as we start to get to the point of recognizing what the hesitancy looks like in our community. Really, idealistically, our opinion is we should open this up to everybody. We should get all of the willing vaccinated, because at some point we're going to need to figure out who hasn't received this shot, and we're then going to have to need to really go market the effectiveness of the vaccine, the safety of the vaccine to those communities. And we can't do that until the willing have all been vaccinated. And we can look at the data. We can look at the data from zip codes. Then we can go into those zip codes and we can figure out who hasn't gotten the shot. And we can go target, market this so we can get those people vaccinated. And so hesitancy is there, but we don't have a good hesitancy strategy until the willing have all been vaccinated. So that's one. Two, the biggest risk to our community's success that we've had is the New York City variant. And we should be putting shots in arms as fast as we can. And we should also be targeting the areas where that risk could happen. So where let's just be realistic here. Where could this happen? It could happen if we have students who live in downstate New York who go home and then come back, right? So I've said we should vaccinate college kids. We should. It helps mitigate that risk. That person goes home, comes back. They're not bringing back any COVID with them. And two, travel, right? So the key is that we've gone through, done a great job vaccinating our most vulnerable to bad outcomes. Hence, we've seen the hospital numbers and the new case numbers and those demographics go down. Now we really need to open up the vaccine eligibility to everybody, and then give local communities the ability to micro-target where there's problems in their community, and avoid some of this risk. So looking at one of our great partners, though, we've been doing homebound vaccinations this week. Nessentia Health's been a great partner helping us get to our homebound seniors, and we'll continue to work that. We will be adding appointments for Monday and Tuesday clinics tomorrow. So Monday and Tuesday we'll have large clinics here at the On Center. And then working with other members of the community, our deaf and hearing impaired vaccine registration for those who are deaf and hearing impaired in the community who need assistance getting a vaccination appointment. We have a partner, Whole Me Incorporated. They'll assist. So please call 468-3275 or email at wholemeinc.com. And this service will help our deaf and hearing impaired community get registered for the vaccine. So I want to thank them for their partnership there as well. Looking at testing, please, we're getting close to a school break again. We talked about before, we were a little worried about February break. I think after February break we had a couple different little tweaks, and so please take advantage of testing. Any symptoms, get a test. In addition to that, community test sites will be open, Shove Park and Onondaga Town Hall today, tomorrow, Town and Clay Senior Center, ongov.net to register for those. One of the issues I want to really highlight, and we're going to talk more about it related to the pandemic, is the mental health of the community. A lot of people are struggling, and I just want to give you some data, and we're going to talk more about some specific plans to try to help people. But we have seen a tremendous uptick with mental health calls and suicide calls to 911. From 2019 to 2020, we saw a 12.6% increase in those calls. And through January and February, so we had 19 to 2020, increase 12.6%. Not good. And then from 2020 to 2021, in January and February, we have seen an additional 15% increase. We know this is happening throughout every age group, and I'm very concerned about our kids. We'll talk more about some of our plans in the immediate future related to that. But if you need help, and I think we need to, as a community, get away from any stigmas with mental health. There's no reason to be embarrassed if you need help. We all need to kind of step up and lead in this space so that people get the help they need. If you please recognize we have support services at 211 for you if you need some help or you know somebody that does. But also the National Suicide Prevention Lifeline is 1-800-273-8255. You can reach out there as well. We've been through a lot of trauma as a community, individually, in all of our own lives, and the isolation has had an impact. And it's probably going to be one of the largest post-pandemic impacts we're going to have to deal with related to addiction and opioid use, and certainly the mental health of our young people and our adults. So please, this is something that we need you to get help if you need help, and we'll be talking a lot about this in weeks to come. Happy to take any questions.
Ryan, do you have the raw numbers behind those percentage increase in 911?
Yeah, so from 19 to 20, it was about 1,000 more calls, and then I can get you the increase for January and February. I got the 15% number, but it's pacing out to be much more than that for 2021 as well. Are you the only one here today, Tim? I know I can't really see well, but
right.
this is
I'm
pretty.
the only one with a microphone.
Yeah, okay.
How did I saw a Syracuse University trolley outside when I came in? Was there much of a take from SU students?
Yeah, my understanding was there was a couple different. Again, our goal is to encourage the community to look at the existing eligibility regulations. The state always said they thought that when they opened up comorbidity eligibility, that would lead to 75% of eligible residents in the state. We just haven't seen that kind of participation in our county. So what we did is we asked our partners across the community, but specifically, it's no secret, I believe, that these colleges should be vaccinated, and I think it will eliminate the risk to the general public, and this pandemic will end quicker. And specifically before you have different types of breaks. I don't think they have a spring break this year in college, but certainly it's a race. So what we have done is we've encouraged the colleges and universities in the community is to go through the eligibility criteria, understand that some of these comorbidities, when you look at things like BMI, you look at hypertension, these are things that maybe weren't an issue for people going into this, but certainly I know what it's like to have blood pressure issues. And so there's more people that qualify than what they think. And everybody should go through this because if you do qualify under some of these lists, we want you to get your shot. We have supply. So I think they went through. I think certainly there were some students that did qualify after assessing what the requirements were. I'm sure at some of the other colleges and universities, too, there will be as well. So I think they did a couple different trips today with that. And we need these campuses engaged. We need them active. We need them essentially getting these populations ready. So the second you can turn on the faucet 100%, we can get these populations vaccinated quickly.
Are you seeing, you alluded to vaccine resistance, are you seeing pockets of resistance in certain demographics or certain areas yet that you can identify?
It's tough to tell, Tim. We think we see some, but you really can't. You cannot base a marketing or outreach campaign right now, in my opinion, until you really know what the data says. Until you have 20,000 doses to give out, and you only can give out 3,000-4,000 a week for a couple weeks, then you know you've hit your peak. And so one way of trying to figure out what's the willing participation is to do these pre-registrations. That gives you a sense of activity, in each demographic, and then it gives us a list if we can't find people who want the vaccine. But it gives you a sense of where you're going to end up, right? So we got 155,000 people today that have been vaccinated. To get to 75% out of the adults, we need about another 100,000. to be quite honest with you, the 50 and above, the 50 to 60 demographic, slowing down big time, big time. So I think that demographic's already been somewhat exhausted. So you then go to the next demographics. You know, do we got 100,000 people between 16-year-olds for the Pfizer and up, or 18-year-olds and up for everything else, between 18 and 40, or 18 and 50? I don't know. I don't know. So then you get as many as you can, and then you got to go through and figure out what's the plan to get to that 75, 80% herd immunity, and where are you really lacking and what zip codes, because then you got to go micro-target. But right now, any other effort is proactive efforts, but it's not data-driven proactive efforts.
Well, I've seen some counties have expanded those lists right down to age
18,
18.
yep. Yeah, a little bit smaller than us. So I talked to County Executive Pacenti about it today, and Madison County, a little bit smaller, right? So we got 3,000 people still in the 40, pre-registered under the 40 demographic. We want open up to 30 to see how large that list gets, because that will be important for us. If we're talking to the state and we can give them data, this is why you need to open it up to everybody. We got a registration list in our county, 30 to 50 years of age, and there's only 8,000 people on the list. You know, we got 8,000 vaccines a week essentially ourselves, let alone the fairgrounds. So it's important, because at some point there's going to need to be an outreach effort to address the hesitancy issue to get us to the immunity numbers we need to be at.
How many of those 3,000 people got called today?
I think some people got called yesterday. I think there's 3,000 still on the list.
Do you know how many people?
I don't. I think the numbers picked up a little bit on today and tomorrow, but certainly if Monday and Tuesday the numbers are low, that list will get utilized.
I may have missed this, but have you heard any news about whether bars will be able to stay open past 11 on Saturday?
No.
You have a over/under on that?
That's a great question. I mean, I can go on a rant right now if you want me to, or I can save you the rant. Geez, I don't know. It was interesting. The governor was asked the question, and Dr. Zucker kind of gave an answer that left the door open. If Dr. Zucker looks at our data, and people look at where our risk is in Central New York, our risk isn't right now necessarily is great. Our biggest risk is outside COVID coming into the community, and in certain pockets that I can vaccinate a lot of that risk away. So the best thing to do is let us vaccinate everybody in this community, and then let these businesses who have been hamstrung by these regulations open up. But I don't know. It puts us in a very bad position related to regulating. And again, we're not going to put people in harm's way over arbitrary 11 o'clock, 11:05, 11:25 rules when we know there's an event driving the kind of activity there, and it's not out of control chaos. It's people watching a basketball game.
Why did you say the New York City variant is the biggest risk now?
Yeah. I think it is, Tim. I think if I think overall we'll do well with it because of what we vaccinated, the percentage of our community. But when you look at how we can do better, and this is my job. I'm not trying to be critical of anybody, but my job's to advocate and protect our community. I have vaccine in the freezer. I'm having a hard time getting it into arms. I know where my cases are. I've proven where the cases are. They happen to be the populations that aren't vaccinated. And out of some of those cases, the population is even more micro-targeted into congregate settings that I should be able to vaccinate. And those congregate settings, when they leave somewhere, they go back into these areas that have their own variants. So let's eliminate the risk for the community by letting me use the tool. It's frustrating for us because we have a plan that will execute, and quite frankly, we know it will work. And so we're in a different spot than I think Hudson Valley region today is 4.4, Long Island 4.7, New York City 4.2. But if you look at Mayor de Blasio's numbers, he has the New York City numbers much higher. So we shouldn't be paralyzed in central New York because other parts of the state aren't vaccinating at the same rates, or other parts of the state have more government workers that still need to be vaccinated, or more people in these demographics. We should be allowed to take care of our community. That's what I was elected to do.
If you were in charge, would you open up eligibility to everyone based on 16 and up, 18 and up?
We would do 18 and up, yeah. Yeah, I think you do 18 and up, and you work through that. Again, we would probably micro-target certain populations in that. There's enough vaccine to do it and get through. And with all the partners you have with the pharmacies, and you have, we're helping, Wegmans is doing, I think, a pop-up. They might even have done it out of Drivers Village. I think we helped redirect some more vaccine to them. They had good participation. But the State Fair site has done a great job with supply there as well. So there's supply in the community, and everybody's, it's not just us. And it's not just, you see other counties have these lists for a reason, is because they have vaccine. We're not going to give it back. We're going to put it in people's arms. Every American citizen has a right to the vaccine that scientists say it's safe to. So we're not going to be, at this point, we're being micromanaged.
Brian, do you have updated demographics on who has been vaccinated in terms of ages and racial groups?
I'll get that report later on, so we'll probably update everybody on Monday. I know last week we did, in the report, we moved up. A lot of our pop-up efforts have been working, and we moved up in our African-American data. We were about 7%. We moved up to 8.7%. So we'll see if that trend's continuing. But we'll get that report and brief everybody on Monday. Any other questions?
Do you have a prediction for this weekend?
Yes. Very good question. Best question of the day. If you noticed before,
I did see your tweet that you got a special birthday present. You know, you're here now.
I did. I did.
7%.
Yeah, so I technically, Trish, I don't consider myself 41 until I've been able to celebrate my 40th birthday with my friends, and I haven't been able to do that yet. So I'm still kind of 40. But my staff, I'm a big Orange fan. We talk about analogies all the time. My staff got me a very big picture of Joe Girard today in my office, so it's a nice. I have a very loving staff, and they got me that, so I really appreciated that. But Syracuse, if you noticed, I was pretty close to outside of Rutgers melting down against Houston last week. I was very close in predicting at least that side of the bracket. But Syracuse has Houston. Houston's conference a little bit weaker, they're probably a little bit overseeded. Good team, though. They have long guards defensively, so they can create some problems for us with our shooting. But I do believe we get the win, and I think we'll be playing Sister Jean and the Loyola Chicago team, and then all bets are off at that point. But I do think we get the Houston win, and I do think we'll see another great team effort. This team's playing fantastic right now.